Hello. Okay. Okay. Today I am going to show you that on the basis of edema that surrounds the lobar bleed, we can differentiate that either this bleed is due to AVM bleed, or either it's due to amyloidosis bleed, or either it's due to metastasis disease, or either it's due to infarction bleed. Okay, so in this case you can appreciate that a lobar bleed is seen in the right temporal lobe, and you can see very little surrounding edema. As compared to size of the bleed, the surrounding edema is very small. Okay, so whenever you see very little amount of edema but bleed size is more advanced, or more increase in size, then always think about two conditions. Okay, if the patient is young age, almost 35, 40, 45, then think that this bleed is due to AVM. The underlying cause is AVM of this bleed, and perform CT angiography for further evaluation of the AVM to see nidus and drainage vein. Okay, now in this case you can see that there is a lobar bleed but very little amount of the edema, surrounding edema. But this patient is the 70-year-old age patient, advanced age patient. Then think about that this bleed is due to amyloidosis. Okay, and cerebral vascular amyloidosis. Okay, amyloidosis is a condition that basically affect the blood vessels. Okay, and now if the bleed size is less but edema is more, as in this case you can appreciate that this is the vasogenic more size of the edema, then always think about two conditions. Okay, one is the metastasis disease and other is the infarcted bleed. Okay, so how can you differentiate both? On the basis of type of the surrounding edema. In this case you can appreciate this is the vasogenic type of the edema. So this is the metastasis disease, gray white matter junction you can appreciate, and I will further recommend the CT scan with contrast to see the enhancing nodule or mass underlying this bleed. Okay, and if you see lobar bleed but the edema surrounding is more but in cytotoxic form, so then think always about this bleed is due to the infarcted bleed.